Good morning. Welcome. I'm Steph Bertozzi. I'm the Dean of the School of Public Health here at Berkeley. And it's my pleasure to welcome everyone to this symposium, which is breaking ground in a number of ways. It was very fortuitous. UCSF and Berkeley were both thinking about organizing a transdisciplinary symposium on oral health. And it wasn't just that they were thinking about organizing one, they were thinking about organizing one on the same day. So the efforts came together, and we're here today in a collaborative effort between the two universities to address an issue that is going to draw in from many different disciplines and hopefully many different parts of both universities. It has been a real education for me. I've only been here about 6 months. But when I first met Karen Sokol-Gutierrez when I got here, and she told me a little bit about the work that she was doing in oral health, I realized a connection between oral health and something that I've done much more work on, which is nutrition, that, to be honest, I hadn't realized before. I'd thought of oral health as being much more an issue for infectious diseases, for obviously pain and oral hygiene, for cosmetics, for all kinds of things. But I'd never thought about the intimate connection between oral health and nutrition, and which is really foolish because I was responsible for the evaluation of enormous programs in Mexico focusing on childhood nutrition, and we never collected data on the state of oral health or even on access to oral health services. So it's too bad that we didn't have this connection earlier. So I could have done better work back then. And I think that the kinds of discussions that will come out of today and the socialization across different disciplines of the interconnectivity between oral health and other fields in public health is something that is certainly from my perspective very welcome. I'd like to thank Karen Sokol-Gutierrez on our side and John Greenspan on the UCSF side for making this all happen. I really think it's terrific that we've managed to come together, and I hope that the symposium is an indication of a much tighter collaboration across the Bay, which I would hope is also going to be further strengthened by the fact that UCSF has acquired Oakland Children's, and we now have a large population of underserved kids in the East Bay that are going to be part of the UCSF family, and they're very close to us. So it means that we have closer access to populations. I was down not too long ago at the Clínicas La Raza here in the East Bay and saw their oral health services, and they serve obviously a very underserved population. It's the largest provider of community health clinics in the East Bay. So I think that there are lots of interesting opportunities for collaboration across the public health clinical spectrum, and I'm really sorry that I'm not going to be able to stay today. Unfortunately, there's another event that was scheduled for the same day, and that's the visit of the senior leadership from the university in Rwanda. That's also going to be here in the building, and both UCSF and Berkeley hosted the president and the first lady and some leaders in education a few weeks ago. And the president is very no-nonsense. He said he would be following up by sending a delegation, and soon. And boom, they're here. So I unfortunately have to leave you and go up and welcome them. But I promised Karen that I would talk about oral health with them because, and we're going to hear today from Kenyan colleagues about some of the programs in a country just across Lake Victoria from Kenya. So it's hopeful that we can strengthen not only the collaborations across the Bay, but across the pond, as the Brits say. So welcome, everybody, and thanks very much.
Okay, well, good morning. My name's Art Reingold, and I know certainly a number of people here. I'm delighted to see some old friends like Tom Boyce, who's returned to the Bay Area, and welcome him back to Berkeley. In addition to being on the faculty in epidemiology, I have a somewhat new role under our new dean, which is to try and get a little more organized at Berkeley in terms of global health across our campus and to help collaborate in various things with UCSF. But I want to, while Steph is relatively new to the campus, I've been here a long time. I've been here almost 29 years. And the other old friend I'm happy to welcome today is John Greenspan. And I just want to give a little context because there really is a much longer-term relationship between Berkeley and the dental school at UCSF in particular. We've been fortunate over the years to have a number of outstanding dentists from UCSF come and do not only their master's but their PhD degrees here in epidemiology, one of whom, Ben Chaffee, is in fact one of the key scientists involved in the work you're going to be hearing about today, having just finished his PhD here. But another former trainee of ours who's on the faculty at UCSF is Caroline Shabosky. And just to give a little context, starting back in 1988, which I guess is a long time ago at this point, over 25 years, we developed a training program including Berkeley and UCSF, including both the School of Public Health here and the medical, dental, and pharmacy schools at UCSF, nursing as well, but particularly dentistry. And working with John and Deb, and Caroline, we were able to spend about 20 years training people in HIV/AIDS research from a variety of countries around the world. A lot of that work has been in Africa, particularly in Zimbabwe, and that has really borne fruit in a variety of ways. Among others, one of our key trainees from that time period, Dean Midian Chidzanga, is now the dean of the entire, not only the medical school, but the entire health campus at the University of Zimbabwe. And as we move ahead for the next 5 years in continuing our AIDS training with the university there, our former our former trainee and colleague, Dean Chidzanga, is an absolutely vital and central individual. But he got all of his training here at UCSF under John and Deb and Caroline through our training program. And so there really is a much, much longer history of collaboration in oral health between the two campuses that this new activity, or relatively new activity, is building on. So it's really my pleasure to also welcome our colleagues from UCSF and from around the world here. I've been very fortunate to work with Ben over the past several years in the work he did in Brazil on oral health and its relationship to nutrition, and have learned an enormous amount in the process. And I'm delighted he's now staying on the faculty at UCSF and will perhaps be able to continue to collaborate across the Bay in these studies. So in any event, I just wanted to add my welcome to everyone to this beautiful auditorium and wonderful building that we're allowed to use today. And then I'll turn things over to Pam, who I guess will also offer a word of welcome from the UCSF side. So Pam.
I'd also like to welcome everybody and thank you for including us in this really exciting event, building our bridges between UCSF and Berkeley. I want to thank John Greenspan for sort of bringing us together and helping us realize we were planning symposium on the same day. I am chair of pediatric dentistry at UCSF and director of our very newly formed Center for Children's Oral Health Research, which we call CORE. And the focus of this center is to build bridges. We're aware as clinicians that frequently the research questions being addressed are not directly related to the clinical problems that practitioners are seeing. We're also realize that there are many efforts across UCSF in medicine, dentistry, pharmacy, some of which you'll hear about this afternoon, that are all doing great things. And we would really like to help bring these groups together so that as a health care community, we can really make a difference in children's oral health. I was very fortunate to meet Tom Boyce, who is not a pediatric dentist. He's a pediatrician, epidemiologist, but to make the connection between oral health and overall health is what Tom did when he reached out and we did studies together. Really excited to hear of the global efforts. As we started out, we thought that we would focus on UCSF, bringing the medicine, dentistry, pharmacy, and nursing groups together as well as the Center for Children's Oral Health Disparities, known as CAN-DO. You'll hear some of their speakers. And we've just been so fortunate to rapidly now branch out to have this collaboration with Berkeley and look forward to working together with the global community to bring our best ideas and our goals and our problems forward so that together we can make a difference and improve the health and well-being of children. So thank you, and I really look forward to today's activities.